Hello and welcome to Open Line. I'm Starlene Stringer. Public health is getting a lot of attention lately with the nationwide focus on Ebola. But there is a lot more to address in that field. The city of Irving has a board focusing on local health issues year-round. Keith LePeck is on the health board and is an emergency room physician. John Drake is the outgoing health board chair and president of the Irving Healthcare Foundation. I want to thank them both for being here. Thank you, guys.
Thank you, Starlene.
Well, first, let's start with the basics. John, let me ask you this. What is the role of the city's health board?
We're an advisory board to the council. Just in our founding documents, our creation, we were created and established by the council to be an advisory body, and our purpose is to offer vision, advice, and community perspective to the council in matters concerning both community health and related public policy.
And let me ask you this too, John. Tell me about the membership and what types of people actually get involved.
Well, the folks who are on this board are appointed by the council, and they do a great job of picking people that have an interest in health and expertise in health. So we have 3 doctors on the board. We have a couple of nurses. We have a person who's a facilities manager at one of the local colleges. I work at a healthcare foundation. So people that have an interest and expertise in the health and public health.
Wonderful. And so, Dr. LePeck, what kind of authority does the board actually have?
No direct authority. All authority comes through the council, but an advisory role,
okay,
specifically. And they rely on the expertise of the board, and if we don't know something, we can look it up and present it in a fashion that's amenable to the council members, and then they really have the final authority.
See.
So we are an advisory board.
Okay. And I have to ask, John, so why did you want to get involved?
Well, I actually raise funds for the Irving Healthcare Foundation. This is a great day for me. This is my 14th anniversary today.
Oh, well, congratulations.
From the favorite job I've ever had and the favorite city I've ever lived in. And so for me, it was a way to volunteer in a way that was related, and it helped expand my knowledge of what the needs are related to public health. And many times I was so glad to be able to report, for example, when people needed, the uninsured needed access to medical care, to be able to bring messages of the Irving Community Clinic or the health clinic they do every week at the Irving Bible Church. So to bring together my knowledge of health services in the city of Irving and how it helps keep the people of Irving healthy. So it was a great fit with what I do professionally, to do something personally in the way of volunteering.
I love it. And I have to ask you the same question, Dr. LePeck. Why did you want to get involved?
Irving's been good to me too, in that it's just been my favorite place to live since 1981. I actually came here for college and stuck. And I don't know if that's good for Irving or bad, but 25 years in ER, and I thought I might have something to share. It's a great dynamic community with awesome leadership, and you see things going on all the time that other cities kind of copy, really. And so I wanted to kind of get involved and give back a little bit in that regard.
I have to say that Irving is happy to have you, and it's a good thing that you're here. 25 years, I'm sure you've done a lot of good over at the hospital.
Well, we try. Some.
And he's being humble, as you can see here. He's doing great. And so, John, I have to ask you another question. I know one of the issues that the board's tackled is a proposed smoking ban. Why was that such an important issue?
Well, we saw a tremendous health benefit, and in the writings and the research that's come out since 2006, the last time they updated the smoking ordinance, we know there are some great benefits from a more restrictive smoking ordinance. Specifically, if you look at the work of the American Heart Association, the publications in circulation, their magazine, the results are phenomenal in reducing admissions for heart attacks, for pulmonary issues, for stroke. I mean, I brought some data along, and like I said, I don't like to read to adults, but what we provided to the council was lots of documentation that supported. We think Irving will be a healthier community, and we can see these exact same results that they've seen in other cities that's been documented. That would be the expected result of removing tobacco smoke from shared indoor public spaces, not private. People's decision to smoke, of course, is private, and they can smoke in their cars and outside and in their homes, but in shared public spaces, smoke travels. And so you can't, when you smoke indoors in a public space, others who don't smoke are smoking with you. And so we thought that was troubling, but more importantly, we thought we were really driven by the benefits, which was a healthier community.
Healthier communities, what it all boils down to, it sounds
Yeah.
like. And Dr. LePeck, would you like to add to that?
It's an ever-evolving story, and certainly had been going on in a large degree before I arrived on the board. But recent World Health Organization studies on e-cigarette use were thrown into the last mix, and so we actually are going to amend our letter to the council to reflect inclusion of some of the e-cigarette risks as well. So it's an evolving story, and it's nice to have input from a variety of different sources to kind of come up with a good recommendation for the council to act on.
Sure, and I know people have been for it and others against it. And so, John, people that are against it have expressed concerns about the economics, the cost of retrofitting a building, and perhaps even losing business. What's your response to that?
Well, again, I remember we have a beautiful myopia, which is the health. We looked at the health issue. Mm-hmm. We didn't ignore those issues, but as I said to my board after the council considered our recommendation, we're not the restaurant revenue board, and we're not the bingo hall attendance board. We appreciate those great businesses in Irving, but we looked at the health effects of tobacco smoke, and then we really tried to stay focused there. I will say we did provide the council some documentation, though, that really shows that there's negligible effect on restaurant revenues. I mean, all the data, there's a 9-city study out there, and anyone can find it. Just use your favorite search engine and put in smoking ban restaurant revenues, and you'll see that there's really not that much, there's not a negative impact. One thing I thought was really great, though, is just anecdotally here in Irving, there were some restaurants like The Keg, Po Melvin's, and Outback Steakhouse that they voluntarily went smoke-free. We gave awards to some of them for being healthcare heroes for making that choice. But as I visited with, and again, this is only anecdotally, but as I visited with Travis, who's the manager of Outback, I said, okay, tell me, did it hurt you? Did making this choice hurt you when we gave him the award? And he said, we saw a little decrease in our bar revenue, but he said we more than made up for that in our restaurant revenue. Wow. And so I can't extrapolate that to every situation, but what we know is the data tells us there's really no negative impact on restaurant revenues and other businesses like that.
Interesting. And Dr. LePeck, you touched a bit on e-cigarettes, and I know that the health board recently had that as an agenda to really focus on that. What are you looking at in particular with those?
Well, the e-cigarette story is evolving, and as you know, data takes years and years to accumulate to speak to any kind of risk. But it's not a risk-free substance, and there's some of the similar concerns about diffusing chemicals through the air as you do with traditional smoke. And it really is a dovetail issue with a traditional cigarette if you're talking about a public space smoking ban. Obviously, many of the cancer risks for the individual are mitigated with an e-cigarette, but it's not substance free, or it wouldn't be a alternative either. So it's an evolving story, but I suspect that that public space e-cigarette bans will dovetail with traditional cigarette bans.
To be continued, huh?
One thing that I would say too is we were really focused on the effects that tobacco smoke has, not on guests in public spaces, but also primarily employees. One of the really troubling facts, and I watched both of my parents die from lung cancer. So personally, it's not been a cause for me, but it does inspire me to do what's best to protect my health and my kids' health. But we know that if your chances of developing lung cancer are 20 to 30% higher if you live with one smoker. If you're not a smoker, but you live with one, your chances of lung cancer development are 20 to 30% higher. Imagine if you're an employee and you're living at work with 250 smokers, or 75, or 400 a day. That can't be good. It's Russian roulette. And so that was another, I think, really thing that inspired us to say to the council, please consider this.
Interesting. Let's switch topics a little bit. John, I know the board also hears about other things like code enforcement issues. So tell me about that.
It's great. One of the things that we do as the Board of Health is we hear the reports on restaurants that perhaps have been in code violation and to understand the reasons why. It's impressive to see the code enforcement officers and how hard they work to keep people safe, that they enforce the hot hold temperatures, because you can't have exceptions. Foodborne illnesses is not a happy experience for anybody in any city. So if we can avoid that by enforcing the codes fairly, setting those standards, communicating them clearly, and then enforcing them, and that's what we really watched Teresa Adrian and her amazing team of folks do. The other things that we hear about are like vector spraying. Whenever there's West Nile present, they're spraying to protect us so we don't have outbreaks of West Nile virus and other mosquito-borne illnesses.
We hear a lot about West Nile and everything that you're mentioning, people checking on the health of what's going on in hospitals and also what's going on in restaurants. And I want to switch to you, Dr. LePeck, for a minute. We mentioned concern about Ebola a bit at the beginning of the show. What role do you think cities should actually be taking in that?
Well, Irving's fortunate that you have such a well thought out educational outreach mechanism such as this one, and public education is really right in their wheelhouse. I think that's something that's very important. You know, we always look for our national leaders and so forth for more broad scope policies, but just the simple precautions the same precautions as with regard to flu for Ebola or some of these other diseases that are popping up due to the globalization of our culture. And Texas is a border state. Texas is a warm climate state. It's going to be important for the public to be aware of how do I act? What do I do? You know, the Ebola scare got so weird that I even had a patient run out of our ER because they didn't want to sign the the screening paper that we had for Ebola. Have you been to a West African country and have you had a fever? I think she was afraid she was going to get Ebola from the piece of paper because maybe someone else had touched the same pad who might have had it. So the public education really is important. And with regard to Ebola, flu precautions are what you do. And
interesting when you were talking about that patient in particular, but what other kind of concerns did you hear from people, or have you heard, and maybe you're still hearing from people about Ebola?
I've personal friends who've wanted to take their kids and move to the mountains because they weren't really sure what was going on in the Presbyterian area of Dallas, and they happen to live in that area and go to some of those community churches, and a few of my friends stopped going to those churches, and it's sad, you know, because a little education might have helped those situations, and a real economic impact from that. People stopped going out to restaurants, they stopped going to churches, stopped doing some charitable things, and so that's a little sad. And Ebola is just one disease in the whole spectrum. The list goes on and on. You know, you mentioned the foodborne illness. You know, Texas had cases of cyclosporin last year. This is the one that was associated with the Mexican cilantro, and that's a bad disease to get. West Nile, we're getting a little better, but 270 cases in Texas, 4 deaths. Enterovirus, this new thing that's come up perhaps from Central America, enterovirus D68, another disease that you need flu precautions. But we've had 20 cases in Texas, and probably 10 of which in North Texas. Other mosquito-borne illnesses, chikungunya is 20 pediatric deaths, maybe. I'm trying to recall that. Traditional flu last year, a score of pediatric deaths. And now we're hearing reports from the tropical disease people out of New Orleans that we're starting to get Chagas disease in Texas. Oh, wow. 17 cases in Houston alone last year. This is a really bad one. It's an African parasite that attacks the heart as its first symptom, and household pets are carriers. So yeah, this is something that going to have to be tracked. So Ebola kind of fits into this spectrum of disease, and it's one of many. But traditional flu has been much more deadly over time, and will continue to be so more than Ebola, I believe.
Wow, and we're going to come back and talk about the flu in just a minute, but I want to switch to you, John, and I know that you're a very familiar face in the community. A lot of people know you for your work with the Irving Healthcare Foundation. Can you tell me what the goal of the foundation is?
Well, our vision's a healthier Irving, so it fits perfectly with the Board of Health.
Sure.
But every day, my team and I'm one of 4 folks on the foundation, we try to raise about $2 million a year. And those dollars, whether they're grants from foundations or gifts from people who, and the people of Irving are amazingly generous. They have been since the foundation, since the hospital opened in '64. The community really built that hospital through gifts. They've continued to do that. But whether it's buying pieces of equipment for the hospital or funding the low-cost clinic, the Irving Community Clinic, that provides medical and dental care for the uninsured who are 200% of poverty level or less. So that means if you make $44,000 or less as a family of 4, if your household income is that or less, you can go. They ask for a $10 copay for medicine and $25 for dental. But if you can't pay that, they'll still care for you. But you can have a doctor and stay well, as opposed to using the emergency department as your doctor. So if you could go to a doctor and they could manage your diabetes and those types of things, that's one of them. We partner with the YMCA on something that the Board of Health actually commissioned, which was the Childhood Obesity Task Force, and we've had 1,200 folks go through our program to help battle family obesity. We have a dental center. There's a children's therapy center, our children's house at Irving. And new one is a Canine Companions for Independence, the Kincaid campus in North Irving, that will train assistance dogs who will be paired with wounded warriors, kids with medical needs, adults with medical needs.
Nice.
So we have this great, in some sense, smorgasbord of things that people can choose to give to. And some give to, we have donors that give to all of them, and we have some that really focus on the Irving Community Clinic, for example, or the hospital. So what we're blessed to do is to be able to raise those funds. They're raised here in Irving, they stay here in Irving, we're audited, and we have to account for every dollar to PricewaterhouseCoopers.
And speaking of money, I understand you just got news about a big grant that
We
will help
did.
with women's health. Tell me about that.
And it's a great partner. It shows you how our healthcare entities work together. This was a grant from the Discovery Foundation based out of Dallas. It's our first time to ever get a grant from them. And it's $50,000 a year for 3 years, so a total of $150,000, and it will fund mammograms for women at the community clinic.
Very nice.
So women who need those mammograms, it will reimburse the hospital. The hospital is offering them at the lowest possible rate, so we can stretch this grant as far as we possibly can. So we are excited about the women who will get an answer, whether they do they have breast cancer, or hopefully they won't have breast cancer, but this grant will at least let us get them a mammogram, and then if they need care, resources like Parkland and the Bridge Breast Center, we can help work across a continuum to get these people care.
Definitely good news.
It is great news.
There's so much to talk about when it comes to health concerns, as you both have been sharing with us throughout the show. And I want to switch a little bit, Dr. LePeck. As an emergency room physician, you see hazards in the winter months. What are the dangers that come along with using heaters?
Carbon monoxide poisoning is a sneaky disease, and anything that generates fumes or an odor, even though carbon monoxide itself is mostly odorless, should be a concern. Space heaters, not all space heaters are completely safe. Some of them have fuel cells attached. Anything that's burning a hydrocarbon can produce carbon monoxide, so people just need to be diligent when they're working on their lawnmower to keep the garage door open, or certainly car exhaust in a closed space is deadly almost instantaneously. Particularly to the young and the elderly are the most susceptible to any sort of carbon monoxide poisoning. And it's a tough disease to diagnose in the ER. Sometimes it takes a little detective work. If you see one person with these vague symptoms, but you see 3 from the same apartment, now you need to start thinking. So it's a disease that needs special diligence, and the elderly, the young, and the pregnant. We treat those differently, and there are hyperbarics in the metro that we can use if we have to, and so forth. Okay. So it just takes diligence, I believe. And then, of course, the winter month cold exposure issues.
Sure.
And in Texas, we talk around heat stroke, heat exhaustion incessantly, but we don't really talk about the winter diseases, but they're out there, particularly for the folks who work outside and so forth. So just special diligence with regard to that. And then flu.
Yeah, let's talk about flu. Let's come back to that for a minute, because is it too late to get a flu shot? And if it's not, how important is it to do so?
Not at all too late. Our peak incidence tends to be after Christmas anyway.
Okay.
So it's a great time to get a flu shot. And those of us who are in constant exposure, we actually get 2.
Really?
Most of us get one October 1st and then again around the first week of January, because the flu shot has about a 90-day window where it's truly effective. So people at particularly high risk might get 2. But for your average folks, I usually advise my family, my local family, to get their first flu shot somewhere around mid-November so that it carries them through the most difficult time of the year, which tends to go out to April.
Interesting.
Here. We have a late surge. Sometimes there's a dual surge. It's an evolving story with the types of flu, again, just like all these other diseases, and we're seeing new and different strains. But the flu shot's very well thought out, and it immunizes you against the 3 or 4 more prevalent flus in the United States from the year before. So it's a great shot to get. A lot of people don't want it because they're afraid it's going to make them sick.
I hear that often.
We do hear that often. My personal bias is that maybe they could a little bit, but to get truly sick, you were probably coming down with something else and just had the bad coincidence to get the shot, at the same time. Because a fever over 100 degrees after a flu shot really shouldn't happen.
Okay. Well, that's good to know.
Yeah.
And you know what else we need to know from you, Dr. LePeck? The fact that with the holidays approaching, a lot of folks think about diet and nutrition and how to really, stay healthy during the holiday season. Can you give us advice on that?
Well, those who can't do teach, I guess.
Oh, stop.
So keep diligent with your exercise regimen. A lot of people want to just diet, but the human body needs diet and exercise. It's harder in the winter months, but a little bit of activity 7 days a week is better than the weekend warrior who does a lot of activity 1 day a week. Your body doesn't care about that. It's looking at averages, basic metabolic rate. So a little bit of daily exercise is better than killing yourself 1 day a week. So it's actually easier than it sounds. And you have to enjoy the holidays a little bit. So I guess you just have to plan around that a little bit.
We like that doctor's advice to go ahead and enjoy a little bit of good stuff for the holidays. Thank you, Dr. LePeck.
Yes.
And John, that actually gets us to a topic that I want to talk about, and that's the fact that the Irving Healthcare Foundation's been working on a special partnership with the Irving YMCA, right?
Absolutely.
Tell us about it.
Doug Fox is one of the best people in the world to work with. He's the executive director at the Y. And we actually, after we were challenged by the Board of Health, it was before I joined the Board of Health, to develop something that might address childhood and family obesity. We worked together to develop, on this childhood obesity task force, to develop a couple of programs. We first tried going through the Irving schools, and it was one that we were glad we tried. It was an after-school focus initiative, but it wasn't as effective as what we could do with families, because we wanted to reach not only the kids, but the moms and dads who were buying the foods that they were feeding those families.
Makes sense.
So we developed a program called Salsa, Sabor y Salud, and what you do there is that it's an 8-week program. I love it because on Thursday nights I think is the English class, and Friday nights is the Spanish class. And what the families do, they'll have about 30 in each class. They bring a food from home. We provide a lean protein. They have a meal together. Then they divide up and go to their classes. The adults go to their class, the kids go to their class, and then they come back together. There's a Zumba class, so they're getting exercise and they're learning about how to read a label. What is a calorie? What is calories in, calories out? So really it helps them understand their responsibility in eating, exercising, and staying fit. But what most important to us is not just reducing body mass index or reducing the weight, but it's changing their mind.
Sure, and you seem to be doing it in a fun way, because we got to watch a little video while you were describing that, and it looked like they're having a blast. I also want to touch back on something that you mentioned a bit earlier, and that was actually talking about the Canine Companion Training Facility. Tell me a bit about that too.
Well, Irving is the home of the first in Texas and the first nationally partnership between Canine Companions for Independence and the Baylor Scott and White system, and they're building a facility in North Irving. It will have a kennel and dormitories, and what they'll do is they will, out of California where CCI or Canine Companions is based, they whelp these puppies and then they send these puppies, volunteer puppy raisers raise them until they're at an age where they come in for their training. These dogs are amazing. Many of them will have up to 70 commands that they can follow. So it's helping more than my teenagers. I love my teenagers. I love my
They're
teenagers.
Get you for that.
Exactly. But so what is terrific about that is it allows someone who has a physical disability to have a dog that if that dog could open the door for you and help you get your food and help you get your drinks and those type of things out of the refrigerator, that you can live independently. Sometimes it's a companion dog that will, a child who has medical needs, that will be there to comfort that dog, just to comfort that child, excuse me. So they're providing all sorts of assistance dogs, and they'll be producing when we're finally all full up and running. We're building the facility now. It'll be ready next summer, but they'll be producing about 60 assistance animals a year, and they'll be matched with people, not all from Texas, but a great deal from Texas. In fact, an emphasis on wounded warriors because of the Baylor Scott and White health connection to Fort Hood. So kids, wounded warriors, people with disabilities, we will be able to at least provide these assistance animals, and that is a great reason to give.
Definitely wonderful information. Thank you for sharing that
Sure.
with us. I'm going to switch topics again, and Dr. LePeck, we're trying to get a lot in this
Sure.
short program,
Yeah.
and we're almost out of time, but I know at this time of year, often people worry about something that you wish they wouldn't have to at this time of the season and people going into holidays, but that's heart attacks and strokes. What are the signs and symptoms you should look for both?
Anything out of the ordinary in terms of weakness, speech difficulty, vision. We see strokes sometimes that are missed and they're outside of some of the treatment windows because people aren't weak on half of their body. That's the easy one, you know. If I'm paralyzed on half of my body, that's pretty obvious. But you know, if you have an elderly relative living with you who's more confused than normal, you really kind of maybe want to touch base with their physician or bring them to the ER when you become convinced. Even confusion of speech, not only uncoordination of the voice, such as mispronouncing words, just alternating the sequence of words in a system, in a sentence. Or you get the feeling that they're frustrated and that they know what they want to say, but they just can't get it out right. Or they don't comprehend what you're saying to them. These are all signs of potential stroke and a little bit more subtle. And you know, it's okay. People don't want to feel embarrassed. They don't want to waste the doctor's time. We're there anyway. We're there 24/7. We're being paid to be there. Let's come on in. Let's check you out. Let's make sure you're okay. I don't mind a case that turns out to be easy or not a stroke. You know, what we don't like to see is a missed stroke where I can't do as much good for you as I can. So don't be shy. If you think you have a stroke, touch base with a healthcare professional immediately.
Immediately.
Yeah.
And then last, in closing, we're just about out of time, but I want to ask you a question, John, and it pertains to New Year's, because a lot of people will be making their resolutions, and health-wise, what do you think that should be?
I think diet and exercise, the blend of those are the things that keep you healthy. So eat reasonably and exercise a little every day, and I think that is what keeps you healthy.
Awesome, and I appreciate you guys answering all these questions. Now on a personal level, I just want to ask you a quick question, and as it is, what do you find most rewarding about your job?
Right, the whole time we've been sitting here, they've used some piece of equipment that we were able to, that people donated the money and we bought that, a piece of equipment, to save someone's life or to treat them, to give them hope, or to address an issue, or a nurse went to a conference that made him or her a better care provider, and donors funded that. 24 hours a day, my team and I, we're freakishly off the charts in finding our value at work, because we get to work with these donors and then tell these donors, this is what we did with your money. That's the most satisfying. Getting the gift is wonderful, but telling them what happened to it, even
better. And quickly for you also, Dr. LePeck, what's most rewarding about your job?
Finding out that there really is a network out there. Irving really does have that. You often imagine there not being anyone who cares about, you know, the plump kids that you see and you kind of feel sorry for, but there's a network, and John mentioned this, but it is true. If someone wanted to donate to one part of the Irving Healthcare Foundation, such as the child obesity or the Canine, they can do that.
Wonderful.
they can do that. And that's really a neat,
Designate your gift.
There
neat
you
flexibility.
go. Well, thank you both so much for sharing your
Thank
time
you.
and talents with us and telling us what the city has to offer to keep us all healthy. Thank you so much.
Thank
Thank
you.
you.
And thank you for watching. We appreciate you being a part of the show. Remember that we do have an opportunity for you to actually ask any questions that you may have for the next edition of Open Line, which will take place on December 4th. We'll see you then. I'm Starlene Stringer. Thanks for watching.